Dr. Craig, there are reports that doctors are hopeful that a treatment for coronavirus already may exist in the blood of patients who have been infected. Now, what can you tell us about this, and is this possibly that kind of magical cure we've all been waiting for?
It's a great question, and it's really a great hope for all of us providing care. What you're talking about are the antibodies. People that have survived have built up these antibodies that could help those that are currently battling the infection clear it and get cured a lot sooner. We hope that that's true. There's some data from other viruses to think that that might work. We have to be a little cautious thinking that this is a cure-all because it doesn't always work. For example, when I was treated for Ebola, I got antibodies from another survivor, and there wasn't a lot of research on whether it was helpful or not. I had some complications from that myself, and later research has shown that it actually isn't as helpful as we would have hoped for Ebola. So we're hoping that it works for coronavirus. We're not certain. I certainly don't want to bet on it, but we all really hope that it is a magic bullet that can help us as this virus picks up.
We've also heard about the anti-malaria drug, hydrochloroquine. I can never say that, but is this possibly also in the pool of potential cures?
Yeah, and that's a really good question. And again, we're hoping that that works as well. That would be really great. We just don't have enough data. Some of that's starting to be collected now. We know that people have been taking hydroxychloroquine for many medical issues in the past. You know, the one really important thing is that be careful with what you take if it's not given under strict guidance, if it's not given under doctor's orders, because hydroxychloroquine and azithromycin, these medicines that are being recommended, can actually have really severe side effects. They can have impact on your heart's conduction system, especially if you're taking other medications. So again, we don't know that they're a cure-all. We hope that they are. We need more data, but just be really careful with the medications that you're taking because the cure may be worse than the disease.
President Trump, Dr. Craig, has said many times that nobody could have seen the coronavirus coming, but we know that intelligence reports from January and February warned of a possible pandemic. So as a medical care provider, how frustrated are you that we weren't better prepared? And do you believe, as I do, that the biggest reason we are playing catch up is because we didn't and still don't have the testing that we need?
Yeah, it is really frustrating. I saw this in West Africa in 2014 and 2015. I saw how much money and how much preparation we put into the U.S. after that. And a lot of that architecture and a lot of that preparedness has fallen by the wayside. It's expensive, but it's so much less expensive than the over $2 trillion we just passed for here in the United States to provide some economic push to the economy, to get people money from the impacts of the virus. To prepare the whole world for a pandemic every year, we're talking 6, 10, maybe $12 billion. To the amount of money that we're spending just in the United States, just for us to have some economic benefit or some economic help during this time is more than we would have spent if we had prepared the world for 100 years. So I'm really concerned. Many of my colleagues, myself included, have written articles in the past couple of years worried about what's going to happen when we see a pandemic here. And unfortunately, we're seeing that impact. The testing is a huge issue. We're now on Plan C. We're only testing some people. Some healthcare workers themselves can't even get infected. We didn't have the testing we needed to begin with. We botched the testing when we finally got it out. And now we're under testing. And it does have an impact on our ability to know how prevalent the disease is, to know how it's spreading. And it really did leave us behind the curve.
Dr. Craig, we're hearing that with warm weather that this could be better. And I don't know if would you agree with that happening? But then also some people have said when the fall rolls back around, we could see another wave of coronavirus.
We're basing a lot of this off the activity of similar viruses, including other coronaviruses, right? This coronavirus is different because it's novel, it's new. We've seen other similar viruses before, and they have slowed down transmission during the summer months. This happened in the 1918 flu pandemic that ran across the world and killed millions. It went away in the summer and came back in the fall and the winter. We don't know yet. We're going to have to wait and see. We know that Singapore was hit really hard. My parents live down in Florida, and you're seeing a lot of cases that are popping up there. New Orleans. My suspicion is that we're going to see cases for a couple months, regardless of the weather. and we need to be prepared for the worst case scenario.